There's essentially two ways to provide fixation of a total knee replacement. One way is by cementing the implant into the patient's bone, and that has been the workhorse approach probably for the past 20 or 30 years. By cementing the implant into the bone, you have immediate mechanical fixation where the patient can get up and start walking and using that implant without having any worry about loosening of the implant itself. And we now have decades-long proven survivorship of these implants. And so these cemented trays have very good workability, and they can last, like I said, decades. Now, there is in recent years have been more of a push to use cementless implants, or what we call press-fit implants. This does not require the use of any cement. Instead, the implant actually has your bone grow into it, and it becomes yours for life. Now, the potential benefit of a cementless implant is because there's no cement grout holding the implant in. Theoretically, over time, a cemented implant could potentially wiggle free of the grout and become loose. There's a very low risk of that happening, but over decades and decades of wear and millions of cycles, there is a theoretical risk of that happening. With a press-fit or cementless implant, once the bone has grown into the implant, theoretically, it's yours forever. So in a younger patient who may want to go 20, 30, 40 years or more on that implant, and someone who has very good bone quality, a cementless or press-fit implant may be a viable option.